Alrighty, this is going to be a online version of the Stop the Bleed course. I cannot certify you via a virtual Stop the Bleed course, as there is a hands-on component that is required for this, but it will at least get you the information that you need, and that is good to know for all athletic trainers and emergency care providers. Stop the Bleed was created by the American College of Surgeons following the Sandy Hook shootings. There was a lot of loss of life during those shootings due to massive blood loss. So they decided to create this course. This course was put together by, like I mentioned, the American College of Surgeons, the American College of Emergency Physicians, the National Association of Emergency Medical Technicians, as well as the Committee on Tactical Casualty Combat Care. There is going to be a PDF version of the PowerPoint that is normally presented during this course that I'm going to show you, and fair warning that some of these images could be disturbing to people. So number one preventable cause of death is bleeding. We can stop most external bleeding fairly easily, and so it's something that we need to take extremely seriously if it does happen. And where can you use stop the bleed training? Homes, schools, obviously as athletic trainers, things that we can see in our day-to-day profession, office buildings, urban environments, on road trips, active shooter situations. You can really use this training kind of anywhere. There's two main goals when it comes to stopping the bleeding. The first one is going to be recognizing that there is life-threatening bleeding, and then the second one is going to be stop that bleeding. It's pretty simple. There are three ways that you can kind of take those steps to stop the bleeding, and that is putting pressure on the bleeding area, packing the bleeding area, or applying a tourniquet just above the bleeding area. Personal safety as athletic trainers and emergency care providers, we obviously know this. Your safety is your number one priority. You cannot help others if you are going to get hurt yourself or if you are hurt yourself. Obviously, if you can move the patient out of a quote-unquote danger zone for you and yourself, then do so. Otherwise, you might need to leave that patient alone until the situation has become safe, whatever it might be, in order to protect yourself. Again, you should wear gloves when dealing with bodily fluids. I think that we're taught this as athletic trainers a bunch, but sometimes in these types of situations, you may not have gloves. I carry gloves with me almost everywhere I go in my backpack. I believe most athletic trainers do as well, or at least have quick access to some form of gloves. But if you can't wear gloves, that's okay. Still provide the emergency life-threatening care. We can mostly treat whatever infections you may or may not get dealing with those bodily fluids. Your skin is actually a very good protector of this. Your skin is very good at protecting you from those bodily fluids. Now, unless you have a cut or an open wound where things can enter, then yes, that is something that you need to be concerned about. But most of the time, just make sure that you clean your hands or whatever gets blood on it, including clothing, things of that nature, in order to keep yourself as safe as possible. As athletic trainers, we were taught the ABCs, airway, breathing, and circulation. We have a different type of ABCs here in Stop the Bleed. We have Alert 911, which is your A. You have B, bleeding, which is find it. And then C, compress the bleeding, which is what we're going to be mostly discussing about. Obviously, Alert 911, call 911. Know your location. This could be your field. This could be your office. This could be your training room. This could be an off-site location, whatever it might be. Know your location, know your address. This should already be pre-planned in your emergency action plan. And then obviously follow whatever instructions the 911 operator gives to you. And as always, be the last one to hang up when you call 911. Bleeding. Obviously, you want to find for the bleeding. You want to find the bleeding. A lot of the times this is done by exposing the injured area, which is where scissors or knives or just ripping the clothing away can be extremely beneficial for you. Things to look for, obviously, continuous bleeding or spurting out, right? That's arterial bleeding, is blood that is spurting out. Large volumes of bleeding. You'll be amazed at actually how much blood looks large on the ground when it's really not a ton of blood. But if you do see a lot of blood in the area, that is something to kind of raise your red flag. And then obviously pooling of blood as well. You also have to take into consideration that there could be areas where the victim is bleeding a lot from different places. They might have an injury on their leg, they might have an injury in their chest. So in the EMS world of things, we do something called trauma strip, where we take everybody down to their underwear, sometimes even further than that. It's that way we can visualize everything. Make sure that you also check the back of the patients for any potential exit wounds or other injuries on the back that we may not see upon primary first glance. I always like to do what's called a blood sweep. So you take your hands with your blue gloves on, your orange gloves on, any color gloves besides black gloves. You can watch my previous video as far as why I don't believe that black gloves belong in healthcare. And you just start from the head, go all the way down, tucking in their back, and you're touching it and you're looking at your hands to see if there is any bleeding that you can visualize. Places where you can bleed, obviously, as athletic trainers, we know this everywhere. Arms, junctional spaces such as your necks, armpits, groin, and then your body. Compress. This is where you are actually going to stop the bleeding. When it comes to pressure, this is just as it sounds. You're going to apply direct pressure to the wound spot. You are going to use just enough gauze or cloth or whatever you might have in order to cover the area. You don't want too much extra gauze. You want some to absorb it. But even if the bleeding does stop, we're going to keep that compression on there until further medical care arrives, just so we don't pull off any clots or anything of that nature that could cause the bleeding to start back up again. Obviously, you're going to be just focusing on the specific area of the wound itself. For larger wounds where pressure is not enough, you're then going to go into a wound packing situation, or if your time is tight, you don't have the time, you have multiple patients per se, you might need to do wound packing instead of just compressing gauze. For wound packing, you need to pack tightly the gauze that you have in there. Normally this is done with the Z-fold gauze. You can use Curlex, you can even use a t-shirt for these types of situations. But the goal is you really have to stick your fingers, sounds nasty, but you're sticking your fingers into the wound as deep as you can, and then you are firmly placing gauze into that wound, filling it up like you're shoveling dirt into a hole. So you want to have a nice level ground. You're not just pressing the gauze on it and then putting it in. You're really taking it one by one and jamming it down deep, as far deep as it can go until the bleeding stops. After you've pushed all the gauze in as far as it can go, you might need to apply pressure. That's things where like emergency trauma dressings come into handy, where you will need to wrap it around to help keep the pressure on that wound itself. Where can you do compress and wound packing? Really anywhere. I'd avoid it necessarily in the chest cavity area just because of all the organs that you have there, but you can really do wound packing anywhere. For tourniquets, tourniquets are kind of the symbol of stop the bleed that I've seen. You know, everyone's all about tourniquet. You always want to apply the tourniquet 2 to 3 inches above the wound. If you cannot locate where the wound is at, then go as far up as you can on the limb. You also have to remember that you'll use these in situations where you have amputations. So you need to put the tourniquet wherever it's going to be most beneficial, but most of the time that's 2 to 3 inches above it. You don't want to place it over any joints like your elbows or your knees, because that's not going to be any effective. You're going to tighten the tourniquet until the bleeding stops. Tourniquets are very painful. Tourniquets have to be put on very tight, but I would rather have a little bit of pain and live than bleed out and die. In the state of Colorado, nobody can remove a tourniquet besides a physician in a hospital setting, and that should be the case nationwide. So once you put a tourniquet on and compress the bleeding and stop the bleeding, you do not take that tourniquet off. Obviously, athletic trainers should know how to apply a tourniquet to others. Something that I also recommend is that you learn how to place a tourniquet on yourself. I always like practicing and putting it on my right arm, as that is my dominant arm, using my left hand only, as that is good practice to do, just in case my right arm were to be injured in some sense of fashion. Tourniquets can be applied over clothes. Again, I don't recommend that you do that because you need to be able to visualize any bleeding, so the clothes should already be removed. Like I mentioned, tourniquets hurt. And you need to remember that sometimes a second tourniquet might be needed to stop the bleeding. I had a situation where I needed to use 2 tourniquets. It wasn't really a trauma situation. We had a patient who was in psychiatric distress, who had a wound vac, and actually pulled the wound vac out, and the wound vac was attached to some major arteries or bleeding areas, and so when he pulled it out, basically opened up a huge wound that he had already been dealt with, and we needed to apply 2 tourniquets. Besides that, in a trauma situation, I have never actually needed to use 2 tourniquets, but it is something that we need to be cognizant of. In emergency care situations, we need to remember that 2 is 1 and 1 is none, so I always recommend having multiple of all of your emergency equipment, especially tourniquets. There are a bunch of tourniquets that are recommended. I personally recommend the Gen 7 North American Rescue CAT tourniquet, which is the combat application tourniquet. Other tourniquets that are good are the Soft TY tourniquet, the SAM XT tourniquet. There's a bunch of different tourniquets. Please just make sure that your tourniquets are recommended by the TOTCCC recommended tourniquets. Things like the RATS tourniquet and the soft, or not the Soft TY, excuse me, the forgive me, but it's an orange, almost TheraBand type rubber band, very large rubber band. Like I said, TheraBand. Those are not adequate tourniquets that can be used to stop bleeding. Those are mostly for venous blood flow stopping, things that you'll see when you're starting an IV. For arterial bleeding, you need something with a windlass or some form of mechanism. Again, always recommend that you go with a COTCCC recommended tourniquet. There are some pneumatic limb tourniquets. I have zero experience with any of these. I don't, so I can't speak to those at all. When it comes to children, for my middle school and potentially high school or even younger athletic trainers, for infants, small children, things of that nature, things that you need to remember is that the tourniquet might be a little too small. There's a little plastic piece on the back of the tourniquet, at least on the CAT tourniquet, that might prevent it. So you just move the tourniquet up higher than those recommended 2 to 3 inches, and that should cover it. If not, then you revert to your pressure or your wound packing. Everything else is basically the same. The techniques are the same as far as adults and child stopping the bleed goes. It is all relatively one and the same. For impaled objects, obviously you don't remove them. You keep them as stable as you can. You pack around the area, not wound pack, but you pack around the area with some form of padding to prevent the object from moving the best that you can. Improvised tourniquets almost never work. Don't use them. That's why you carry multiple tourniquets. Loss of an arm or leg, obviously this is where you're going to need to use a tourniquet. If you can find the limb, place the limb on ice and transport it with the patient. Otherwise, you don't do it. Or otherwise, you just use the tourniquet and prevent the bleeding best you can. Try and keep the part that is still attached to the body moist to the best of your ability. Pain, obviously tourniquets hurt a lot. Compression and wound packing also hurt. But again, I'd rather live with a few moments of discomfort, rather than losing my life. A lot of people mention that if I leave a tourniquet on for too long, I'm going to potentially lose that leg or that limb. We are finding, as more and more research goes, that tourniquets can stay on much longer than what we originally thought, sometimes in upwards of 24 hours prior to any irreversible limb damage and potentially limb death, tissue death, things of that nature. Something that is always good, though, and something that you always need to remember that you do when you do apply a tourniquet is that you write the time that the tourniquet was applied. I always laugh whenever they recommend using a Sharpie and writing it on the timestamp on the tourniquet. I don't think that's going to work because most of the time that timestamp is going to be covered in blood. So I will write in the patient's own blood most of the time because I'll never have a Sharpie with me when I need it. I will write a big T on the patient's forehead along with the time that it was applied. That way I know where it's at. They recommend, for specifically CAT tourniquets, they make an orange and a black tourniquet. I recommend the orange one just because it's a little bit more visible. They also have a blue tourniquet. That blue tourniquet is for training purposes only. Obviously, so kind of in summary, your personal safety is the biggest thing that you need to do. Once you notify that there's big issues, you need to alert 911. And then you need to find the bleeding. Then you need to compress it with either pressure or wound packing. then you need to, or use a tourniquet, and then you need to wait for help to arrive. If anybody has any questions, they can feel free to reach out to me, or they can go to the Stop the Bleed website, which is stopthebleed.org. There you can purchase Stop the Bleed kits, things of that nature. Feel free to reach out to me if you have any questions. And again, remember that the only thing that is more tragic than a death is a death that could have been prevented from stopping major bleeding. So thank you and have a good day.